I just had to go grab a filter so that I can let you demonstrate on me.
Okay.
Let me set it up first. Make sure everything is working. Okay. And then I'm gonna place this in here, the filter. I'm gonna put in my patient information. Okay, so before you perform, I want you to instruct me on how to perform the actual PFT, okay?
Mm-hmm.
And so we're gonna get started here shortly. But before we get started, I want you to tell me to breathe in fully and then get a good seal around the mouthpiece. And then I want you to tell me to force out of the chest as hard and fast as I can until my lungs are completely empty. And then I want you to have me to breathe in again and relax. And then exhalation must continue until no more air can be exhaled, but must be at least 6 seconds, but can be up to 15 seconds.
Okay.
Okay, so ready?
Mm-hmm. So you're going to inhale fully, get a good seal with your mouth, and I want you to blow out as hard and fast as you can till you have no more air in your lungs. Oh wow, I see the little form. Was that great?
That's awesome.
Okay.
Yeah. Okay, and we're gonna perform this test two more times because you have to do a total of 3.
Mm-hmm.
And like if you were to document the findings here, then you want to always take the highest values and report them
Okay.
in your chart.
Okay.
Ready?
So inhale fully, good seal around your mouth, and blow out fast as you can until the air is empty. Okay. So that was 2 times. So we'll guess one more time. So inhale fully, good seal around your mouth, and blow out fast and hard as you can until all the air is empty out of your lungs. Oh wow, look at that one. I think that was gonna be your best one.
Yeah. Great job. You did an awesome job there. Okay,
These
so
are cool.
that is the only machine that we have here. This is one of our older models, of course, but yes, it's excellent.
All right, so I guess now I understand a bit more how spirometry is a valuable tool used in the diagnosis of COPD. How often is it checked?
It is assessed on a needed basis. The goals of COPD assessment are to determine the severity of the disease, its impact on patients' health status, and risk of future events such as exacerbation, hospital stays, and death in order to guide therapy. Assess the following aspects of the disease separately. So you want to assess the symptoms, the degree of airflow limitation using spirometry, the risk of exacerbations or comorbidities. Symptoms are assessed by validated questionnaires, and here's a questionnaire here for you. Validated questionnaires such as the COPD assessment test or the clinical COPD questionnaire are recommended for a comprehensive assessment of symptoms. The Modified British Medical Research Council scale provides only an assessment of breathlessness. Risk of exacerbations are assessed as well. An exacerbation of COPD is defined as an acute event characterized by a worsening of a patient's respiratory system that is beyond normal day-to-day variation and leads to a change in medication. The best predictor of having frequent exacerbations is whenever a patient has 2 or more a year. Okay? Sorry about that. Is as airflow limitation worsens. Hospitalization for COPD exacerbation is associated with poor prognosis, which is an increased risk of death. Okay? Cardiovascular diseases, this is when you are assessing comorbidities. Cardiovascular diseases, osteoporosis, depression and anxiety, skeletal muscle dysfunction, metabolic syndrome, and lung cancer, among other diseases, occur frequently in COPD patients. These comorbid conditions may influence mortality, and hospitalizations, and should be looked for routinely and treated appropriately.
Oh, okay.
So this basically concludes about what I'm telling you about the.
I think I thought that was very interesting.
It's very interesting. But give me just a moment. I actually have a phone call on hold, and I'll get right back with you. I'm so sorry, but today has been a busy day in the CCU.
No, you're fine. Thank you.